looking at a case and measuring a device. All right? So after today and tomorrow, you'll know the first part of your practical exam. So my patient, I've decided that they need a rolling walker. Okay? So I'm gonna greet my patient as usual after I wash my hands and everything. And I'm gonna ask them, are you right-handed or left-handed?
Right-handed.
Right-handed, okay. And then I'm gonna say, how tall are you?
5'11".
5'11", okay. So I'm gonna do the rolling walker, so I'm going to bring him to the parallel bars. Now, I'm not gonna ask you to do it on the exam because then you'll spend 10 minutes doing it, but you should always, when you are using parallel bars, you should always measure the parallel bars to the patient. So, again, greater trochanter. These are actually really good for me. Okay? So, most parallel bars are, a lot of parallel bars are electric. So, after you ask the patient how tall they are, if he's 5'11", I want to put these up, and I just kind of step on it with my foot, and the parallel bars go up. So I want those parallel bars to be adequate for his height. Okay? I go and I say, okay, so we're going to measure you for a device, for the walker. Okay? I've established what his dominant side is, or his affected side. He's right-handed. I'm going to assume the left side is a little weaker, or it's affected. Okay? If he has non-weight bearing on the left, I don't have to ask what's your dominant side, right? I know I'm going to guard him on the left. Okay? So then I say, if he can, just like when you're doing transfers, ask them to move your leg out of the way. I'm going to take this off. Okay? I'm going to put it up and out. Okay? Then I'm going to take my other, and I'm going to take this up and out. Then I'm going to ask him if he can to lift his legs up while I bring him flush to the parallel bars. Okay, can you pick up your legs for me? Great. If he can't, if he has paralysis, I'm going to guide his legs, and he's going to propel the wheelchair. Okay? If he can't propel the wheelchair or manage his legs, I'm in trouble, right? I don't know if I'm going to ambulate him. Okay? Brakes on, seatbelts on. Okay, great. Now, some people like to put their chair into the bars. It's fine. If you want to wheel it in here, up a little bit, it's up to you. I don't really have a preference, to be honest. As long as the wheelchair is flush and his feet are flat on the floor and not on the slanted part, I'm okay. Okay? Before I take the seatbelt off, I gotta make sure that this is next to me. I don't want to leave my patient alone in the chair unless they have their seatbelt on. I don't want to leave my patient standing and walk across the room. Okay? Sit them down, put their seatbelt on. Do not leave your patients. Do not do this with your back to your patients. Okay? Unless they're sitting with their seatbelt on. Don't take your eyes off anybody for more than a second, because things happen. Okay? Okay, you're 5'11", okay? I'm 5'6". I'm guesstimating this is okay. All right? Now, I can stand him up in guarding outside of the bars. I can stand him up being in the bars with him. If I'm really worried about him, I'm going to put a gait belt on. Okay? But I want to stand him up in a way that I feel that I can guard him well. Okay? So say he has a little bit of loss of balance backwards. Okay? I'll stand in the bars with him. Okay? I'm not going to open this up. I'm going to keep it closed. Okay? All right, I'm gonna have you stand up and just hold on to the bars. Okay? Okay, nice and close, just like you are. It's a transfer. It's a sit to stand transfer. Okay? Scoot to the edge. Great. Okay. 1, 2, 3. Usually push from the wheelchair. Good. Step forward. Excellent. Okay, let me do it on this side so you guys can see. Okay, pretty good. Okay, drop your hand for me. Put your hand on this for me. Great. Okay, I think we're good. Okay, put your hand back on the bar. Don't take my eyes off of him. Step back, reach, and nice and easy. Put your seatbelt on, please. Okay, if I need to make my adjustments, now I'm making my adjustment. Okay? You've got to make sure your devices don't fall. Okay? Don't have them fall on top of a patient. If they're crutches, like this is pretty stable, you can usually lean it. Crutches tend to do this. Okay? So put them like this so they don't fall on top of the patient. Okay? Let me just show you crutches. You're 5'11", you said, right? This might be too short. They go to 5'10". I don't know if we have the extra tall out or not. I have to ask Mr. Mitchell to get out. Okay, go ahead. And up we go. 1, 2, 3. Hold on to the bars. Good. And you see how the bars should be adjusted to his height? Because he can't really grab well, right? 6 inches out. Yeah, these are too short for you. Okay, drop. You see how he's doing this? Drop your shoulder. You should be up 1. These go up to 5'10". Okay, put your hand down. Put your hand on the grip. He doesn't have enough flexion, right? You can see if they were up 1, he would probably be okay, right? Okay. Now, if I want to gait train in the parallel bars, I can do that too, because they're safe, right? I can put a gait belt on. I can be on his weak side. I can be outside the bars. Oops. On this side, and I can guard him, right? And he can ambulate in the parallel bars, and I can walk him out of the parallel bars. But I always want to kind of try it in the parallel bars just in case, right? So I can do that, and I can have him walk out of the parallel bars, and then we can walk down the hallway or whatever. But first time you see somebody, you always want to kind of overshoot and be conservative. And just make sure that you understand their abilities and how much assistance they're going to need. Okay? Everybody good? Okay. So guarding in the bars if I need to. If if I'm really worried about them. Not every place has gait belts. Some places won't even let you ambulate a patient unless you put a gait belt on. Some of the subacutes, like you'll always know the PTs because they're like this walking, or like this. They have it around because they're carrying, they're carrying crutches and they're carrying whatever. They're goniometer, and then they've got the gait belt around their waist. Okay, let's put a gait belt on you. Of course, I would do it in the chair. I know Professor Ross doesn't use gait belts much, right?
No, not really.
Yeah, because it's true. Outpatients are not going to have it, right? Probably. But if you're in the hospital and you're in subacute, it's really because you got him. I got him. He's not going anywhere, right? Okay. So when in doubt, especially if you have a patient with ataxia, paresis. poor, balance issues, put a gait belt on so you can, always hold on to them. They come in small, medium, and large usually.
Is
So.
it supposed to be tight?
They're not, this is probably okay for you. It's a little loose, but, you just don't want it like coming up like this. But this is probably okay for you. You don't want it too tight because then it restricts the breathing. Okay? Questions? Okay. So people can be here, people can be here, people can be, in between the tables. And practice getting your hands on the devices, adjusting the devices, popping things in and out, guarding, managing, standing, and trying to guesstimate. And then, if you have to double check, stand them up one more time, but don't stand them up 3-4 times. Because everybody like, again, I have to stand up. I'm exhausted. I just had surgery yesterday. Okay? Okay.